Hello, I'm Dr. Amy Schreibman. I'm a nurse practitioner and a doctor of nursing practice. Welcome to Medical Minutes. Today we're going to discuss multiple sclerosis. Multiple sclerosis, also known as MS, is a progressive immune-mediated disorder. That means the system designed to keep your body healthy mistakenly attacks parts of your body that are vital to everyday function. The protective coverings of nerve cells that are damaged, that leads to diminished function in the brain and the spinal cord, so it affects the nervous system. MS is a disease with unpredictable symptoms that can vary in intensity. While some people experience fatigue and numbness, severe cases of MS can cause paralysis, vision loss, and diminished brain function. Common symptoms of multiple sclerosis include vision problems like blurred vision, double vision, or loss of vision. People may also experience pain when looking up or to one side, and loss of vision may also occur. Numbness and tingling may also occur. Most common sites of numbness and tingling include the face, the arms, the legs, and fingers. Chronic pain and involuntary muscle spasms and muscle stiffness are also common with MS. People might experience stiff muscles or joints, as well as uncontrollable, painful jerking movements of the extremities. The legs are most often affected. Back pain is also a common finding. Unexplained fatigue and weakness affects about 80% of the people in the early stages of MS. Chronic fatigue occurs when nerves deteriorate in the spinal column. Usually the fatigue appears suddenly and lasts for a few weeks before improving. The weakness is most noticeable in the legs at first. Dizziness and problems with coordination and balance can also occur. People with MS often feel lightheaded, dizzy, or as if their surroundings are spinning. This is also known as vertigo. The symptoms often occur when you stand up. 80% of people with MS can experience symptoms related to bladder and bowel dysfunction, which include frequent urination, strong urges to urinate, inability to hold their urine, constipation, diarrhea, or complete loss of bowel control. Sexual arousal can also be a problem for people with MS because it begins in the central nervous system where MS attacks. Cognitive dysfunction occurs in half of the MS population. This can include memory problems, shortened attention span, language problems, and difficulty staying organized. Emotional changes can also be an effect of MS. People with MS can suffer from mood swings, depression, irritability, or uncontrolled crying or laughter. People with MS may also experience slurred speech, seizures, hearing loss, and trouble swallowing. Diagnosing MS is important, and if you are experiencing any of these types of symptoms, you must see a neurologist. That should be your first step. Your neurologist will perform several tests to make the correct diagnosis. This will include a neurological exam to check for impaired nerve function, a series of eye examinations to evaluate vision and check for eye disease, an MRI or magnetic resonance imaging to examine cross-sectional images of the brain and spinal cord, and a spinal tap, also known as a lumbar puncture. This involves removing fluid from the spinal column, which circulates around your brain and your spinal cord. Doctors use these tests to look for damage to the central nervous system in two separate areas. They must also determine that at least 1 month has passed between the episodes that caused the damage. These tests are also used to rule out other conditions. MS can vary in both its severity and the ways that it affects people. Attacks can last from a few weeks and then disappear. However, relapses can get progressively worse, more unpredictable, and come with different symptoms. Early detection may prevent MS from progressing quickly. There is no cure for MS. Therefore, depending on your symptoms and occurrences, you and your neurologist can best determine what treatments are best for you. However, early intervention is key, and things like physical therapy and medications can provide optimal state of well-being. If you have any questions or you'd like to find out more information on what we discussed today, please feel free to leave them in the comments section below. I'm Dr. Amy Schreibman, and this is Medical Minutes. Please don't forget to follow us on Facebook and our website, The Boca Voice. I look forward to seeing you soon in the next Medical Minutes.